Thank you so much for coming on this episode here. And I'm so excited to get to talk to our community about Dr. Connect. Thanks so much for coming on.
Thank you for having me, Matt. Glad to be here.
So where in the world are you right now? I want to go ahead and just help everybody to know where you are right now.
We're currently in Brooklyn doing some work with a professor in NYU trying to build more capabilities for Doktorconnect. So I've been here for a week and it has been going on very well.
That is wonderful. And one of the things you're going to hear about right now is that Dr. Connect is a global innovation that's being spread, which is why I'm always interested to hear where Dr. Joseph is in the world when we get to speak. And on that, why don't you tell our listeners about Dr. Connect and what it is that it does?
Thank you, Matt. I want to start by saying Doktorconnect was born out of a tragedy. And the tragedy was because my friend Jim passed away at age 42. He had an autoimmune disease that affected his pancreas and he could not produce insulin. And the only way Jim found out was because he stepped on a nail at his office. A software engineer fit as a nail. That wound, that puncture led to a bone infection and eventually led to sepsis, and they had to amputate Jim's leg. And Jim committed suicide because he went into severe depression. Nobody could talk to me out of it. And that was when I had a wake-up call that there should be a better way for us to know what is going on in our body. Our healthcare system is one of the best in the world in the US, but it's very complex, expensive, it's fragmented, with poorly coordinated, and there's a lot of health equities abnormality within it. And the story of Jim is 1 in 4. And that's why Doktorconnect was born, to address preventive care and to deal with the chronic disease management that we face up in that we're faced with in the US. Thank you, Matt.
And it's an epidemic. I mean, you just noted, I mean, 1 in 4, people are dealing with, diabetes, which will lead itself to even greater, more complex chronic diseases that, people are having to address. And, and it's so important, that you can monitor these things. And it's not easy to do. It's not easy to do it all. So how does Dr. Connect help to make that an easier process for what is a, population that is usually, older, not always. We actually have some good friends that are pretty young dealing with it. But how does the software and the tools that you have help a patient manage that chronic condition?
Thank you, Matt. So Doktorconnect is a platform. It's a user-friendly platform that is designed to push for personalized and precision medicine, which means we're able to use the wellness robust data and combine that with IoT devices to track health metrics that are important to us, so that we can have better insight to our health. So we have a platform which you can download from an iOS or an Android to your phone. And sincerely, Jim, Matt, we brought it down to simplicity, because one of the things we wanted to solve for was fragmentation. So when you come to our platform, within our app, you're able to do 3 basic things. Number 1, you're able to do your test, and I will get to what I mean by test. You are able to do your treatment if you need one, and you are able to track progress with wearables devices. What I meant by testing is that when you come to our platform, you are able to order one of our wellness screening packages, which offers over 80 tests tracking over 250 biomarkers, combined with a thorough mental health assessment, because we don't know when Jim's mental problem started. Has it been there all along, or was this trouble that triggered the problem? And then we look for one more source of data, which we give to our client free if they want to. We give them one-time opportunity to do a DNA analysis that will give us a ton of information about their health. So, Matt, with these 3 data points, we have an amount of data that can give us the ability to feed our algorithm we are now able to predict and prevent any health crisis that might happen in the future. Think about it. If Jim was able to do things like this, we will have been able to catch that autoimmune disease, and will have been able to save Jim from that headache, that problem. So if we find anything from these three data points that I've just talked to you about and tracking these many biomarkers, then we're able to provide our users on the same platform instead of going all over to find who is going to solve the problem. We build a team around them, which is if you need a doctor through our partner, you're able to get it. Mental health therapist, you're able to get it. A dietitian, you're able to get it. Even a health coach, you're able to get on our platform. And you have your team right there, your record, your report, your data, all in one place, not floating all over many platforms. And then what is the benefit of a platform that is not able to get a feedback from you or give you feedback so as to improve your health? Then we do that by remotely tracking your progress, either through your own wearables, your Apple or Garmin or Fitbit that you have, where we are a device agnostic. And if you are not able to afford that, we've already partnered with a manufacturer that will give you one of these devices that is able to do 6 things. You're able to collect your blood pressure, blood sugar, the temperature, SpO2, and even do a 2-lead ECG like a cardiac mobile would do. And we have all that circle back to us to improve your healthcare. So those are the three things that we do on our platform, Matt.
Well, that's fantastic too. And during COVID, we saw the boom of telehealth, right? But telehealth was an episodic care, or for episodic care, when I'm dealing with a headache that won't go away or severe congestion to jump in, and people became more familiar, which is a positive, in dealing with it. But that's not the same of dealing with chronic care management, which, is something that needs to be proactive. It can't be when there's an episode that's taking place, as you just noted, right? Then it's too late. An amputation can occur at that point in time. So I really applaud you and the Doktorconnect team for, pushing the innovations around this with the testing part to get that data, the ongoing analysis, whether it's the wearables and what you have there, and then the ability to treat, including the mental health aspect of that, because it is something that is missed dramatically, whether it's cancer care, any other chronic care. People are fighting. We focus on fighting what is fighting the body, and not helping the mind combat what all it's dealing with too. So congratulations on all that. I've really enjoyed getting to know Doktorconnect and what it does through the Velocity and Methodist Healthcare Ministries Community Accelerator, which congratulations upon being selected for that cohort. That's a great and exciting opportunity for the community and for Doktorconnect.
Thank you so very much. Like you said, with our platform has been proven and tested. We were born in the U.S., El Paso, Texas. Shout out to El Paso. But during COVID, we moved to Nigeria briefly just to kind of test that protocol, just to make sure that we're able to get it right. And we've done amazingly well. 447,000 users later, with good revenue coming through. And we're so excited for Velocity inviting us back into the U.S. market to be able to test and pilot with them. Once we're lucky to be selected to pilot with them, it will be an amazing way to see what the lessons we've learned overseas, able to apply that and give our patient in the U.S. a better understanding of what's going on in their body, and able to move from a sick care perspective to a well and a preventive and proactive care.
So just a quick question on that, because, I've had the privilege of being associated with this accelerator, which again, I'm so excited of the impact it does here. But what attracted Doktorconnect to this accelerator and to our community? Can you tell us a little bit about that?
Well, let me give you a little background. About a year ago, there's a competition in San Antonio that they were trying to recruit people to come to the county over there to be part of and I was interested. So we applied, but at that time we were not ready to come into the US. So the moment I saw this opportunity for Velocity, I just knew that this is the right moment and the right opportunity for us to step in. And what is unique about Methodist is because of their background and their network, and they already have everything that we have in place that will make our pilot successful. Practically speaking, we're leveraging their community asset and layering that with technology, because we believe that the best solution in medicine to solve any problem cannot be brick and mortar alone and cannot be technology alone. And we see this opportunity to hybrid both, to use their network and their community assets to layer our technology on top of it so that we can drive a better outcome for patients, and everybody wins. Methodists win by addressing this social determinant of health. Doktorconnect wins because we're able to launch our product in the US. And our patient wins because they have better outcomes and they have a better grasp of what is going on in their body. So it's a win all around.
I agree. I agree. What would it mean to you and to Doktorconnect to be selected in the Accelerator as the winner of the pitch competition for your pilot to be deployed in our community? What would that mean for Doktorconnect?
Well, Matt, you will never know. We've been burning midnight candle. We've been meeting every Sunday after the week to debrief. We've been changing our pitch based on your wonderful leadership and mentorship. It will mean a whole lot to us because we have solutions that we believe can change and revolutionize care. And you know what? A solution that was born in Texas. How
That's
sweet
right.
can that be
That's
if
right.
we can just move to San Antonio? And most importantly, we're looking at this, Matt. We caught the wind of $60 billion facility that the military is trying to build in San Antonio, right alongside Velocity. We are dreaming to be selected so that we can actually open a shop in San Antonio. We're looking at Dallas as our headquarters. If we're able to get it, maybe that might shift our focus and our headquarters to be in San Antonio, whereby we have an asset, we have operation in Qatar, we have operation in Nigeria, and we're looking at France because I was in France last week. And I'll be going back there to talk about Doktorconnect within their tech ecosystem. So it will be so sweet if we win and we can make San Antonio our world headquarters. It will be fantastic.
Well, that's absolutely wonderful. And again, I'm excited for you being in the Accelerator and what the potential is here as we get to the close of it. Let me ask you some questions as an entrepreneur, because our audience is a lot of individuals that are in the startup world, founders, business leaders and business founders here in South Texas. You have a global product. It's Texas born, as you said, but you have a global product and service that's out there. What's been one of the most challenging parts of having such a global enterprise so quickly?
Matt, I'll tell you one thing. Let me start by for you to do a startup. I've been in a private practice. I'm a doctor of physical therapy for 31 years. Closed that up and decided to go into a startup because gym happened.
Right.
Now, listen, for you to even want to do a startup, you must be mad or crazy because it is a beast. So when you talk about challenges are everywhere. I was in a meeting one day and somebody said, "What if you fail?" And I told the guy, I said, "Sir, I'm coming here to you today as a failure because 96% of startup fail, only 4% make it. So if you're thinking about failure for you to do or engage with us, we already failed, but we want to let you know that we're doing everything possible to be part of that 4% that eventually make it." The reason why we have grown so quickly, so fast, is because what the product offers is what the world needs today. Look at the world. Europe is dying. Their healthcare system is budding and about to crash. The US, we have the best of healthcare, but it's so complex. Africa is non-existent. When you look at the Middle East, they have a lot of money, but they are plagued with chronic kidney disease, they're plagued with diabetes and all kind of problems. So my challenge is, number one, how can we scale this as much as possible to cover as many people as possible? Number one, within what makes perfect business sense. Number two, working in so many continents. Like today, I've been up since 2 o'clock, meeting with people in Qatar,
Right.
trying to kind of talk about what is going on in there. So you don't have much sleep. So I myself preaching wellness, I check myself 4 times a year to make sure that I am on top of my game. Then finally, when you talk about manpower, talk about the stress on the body, number 4 is the funding. This day at this time and age, the powder is dried up because of what is happening globally. But fortunately for us, though raising fund has been a little bit difficult, but we're generating revenue and we've been driving our growth with our revenue. So it's been wonderful. It's been tough, but it's been a journey that I will not give up. I will do it again if I have to do it all over again.
You know, I'm so glad you say that you'd have to be mad to do a startup, because some people think, oh, wow, oh, you're an entrepreneur. Oh, you own your own company. You know, you must, have millions of dollars, when the reality is 96%, they're on the cusp of, no longer having that company because so many of them fail, right? It's really just the 4%. And you have to be resilient enough and a little bit crazy to know that the odds are almost against you to succeed, but nonetheless, you're still going to push forward, from there. And I mean, failures, there are no failures. In my opinion, there's just lessons, some of them harder than others, but they're just lessons on there. Speaking of that, lessons, what is one of the early lessons that you had as an entrepreneur in shifting from more, I'd say, traditional professional services into the startup world? What was one of the big lessons you learned early on when moving into the startup world?
So I'll talk about 2 things, Matt. Number 1, I believe the best way to solve what problem. My office in El Paso can only reach, and I see quite a bit of patients. I see about 60 patients a day with all our staff. We have 4 or 5 therapists working in the office. That's all we can see. So our reach is just within that community. But we see how much people we've been able to help with technology. Technology just makes things better. It gives you the ability to reach so many people at such a short amount of time. So it was an easy shift for me, because I know for us to prevent another gym from dying, it will have to be through technology, giving them access to own their own health. People have never taken control of their health, and it's not their fault, because our system has always geared them to say, you know what, you have to be sick to use your health insurance. And that's why we buy health insurance. But that's a strong use of it. So the ability to shift from seeing people that I can touch to seeing people that I'm not able to touch and still have a significant impact on their health is a joy for me every day.
That's what it takes, right? It takes your why and the passion to move forward. I mean, that is a common theme of successful businesses, leaders, especially startup and founders, is a strong passion for their why. And, it's interesting that you say this, and I have a healthcare background, as you know, and, 2 things in the United States is, number 1, care is, it's based upon whatever episode, whatever you're addressing. It's not proactive. Wellness exams, those sort of things go away essentially, once, you get out of elementary and middle school, right? I mean, because they require those in order to get your shots up, but then people don't continue those. But the real interesting thing is the amount of time it's taking for people to be proactive with their healthcare, using wearables in the right way, using apps like Doktorconnect to be able to manage those. What do you see as the adoption in this, part for the United States with regard to people using technology to be proactive in their healthcare?
So thank you for that question. And we were talking yesterday, and that's one of the things that came up that I was really happy and passionate why Doktorconnect was born. So wearable is good. Collecting data is good. But what do we do with the data that we collect? Now, one of the things that I've seen that makes Doktorconnect stand out from other remote patient monitoring or chronic disease monitoring platform or a preventive platform is we do something different. We believe that we have a lot of people that are more educated. AI is on the rise. Gen Z's, millennium, all of these contribute. Even you see older citizens operating smartphone. So the technology is here to stay. What the rate of adoption is what we need to work on so that we can see how people are taking it. So this is what we have done different in Doctor Connect. When we talk about monitoring and taking care of patients, the people are our competition. They give people 6, 7, 8 devices to monitor their tools, to monitor, to collect blood pressure, collect blood sugar. Patients get tired of dealing with 7, 8 devices at a go. Right. Doctor Connect will replace all of that with just one device. Wow. And that device, you can do blood pressure, you can do blood sugar. I think I'm looking for it. I can't find it right here. But you can do your ECG, you can do SpO2, which is the oxygen level, and you can have all that. And it's the device that you can just put in your pocket and you're good to go. Wow. And then we have a weighing scale that can give you more than your weight. And that weighing scale it's just like you're standing on a DEXA machine. So we can get about 14 to 20 metrics about your weight, your BMI, your body water, your protein level, all in one. And these are very vital data that can help you, that can help us to know your well-being. Now, that's all good, collecting data. What are we doing with this data? So most of the time, most of the RPM tools, we push this data to the doctor for the doctor to act on and call the patient if there's a problem. But no, Doctor Connect, we build digital therapeutics within the solution so that if a patient is having issue, we can actually activate that and educate the patient. The nurse manager can actually tell the patient, hey, take advantage of your medication tracker. We built that tool, which has increased and medication compliance about 78 to 85%. The patient is able to take a medication. The family member is able to know that the patient takes the medication, and we can actually loop the doctor in to know that patient is med compliant. And if you're able to even do that alone, right, and the people are medication compliant, you've really reduced you have really improved their chances of getting a better outcome. I'll stop at that.
I mean, compliance is a major part of healthcare, especially with those with chronic care. It's the lack of compliance, with a healthcare plan that is a big factor. So that's huge, absolutely huge.
I'll tell you the reason why. The reason why is people just think about, hey, they're collecting my blood pressure. What are they going to do about it? I'm helpless. I can't do anything. Yeah, but we just built a little tool. We call it an online gym. It doesn't take over your gym. It doesn't replace your gym. But we did it in such an animated way that you can be watching novella and you can sit down there and engage and work with it with an animation, do your little exercise in your home, and you're getting a valuable help with your health, with your metabolism, doing those exercises with those animations. And you are getting results rather than wait for your doctor to tell you, Mr. Matt, your weight, you gained 5 pounds. You need to go to the gym and walk. We give you tools therapeutically to be able to deal with that even before your doctor. And your nurse case manager can work with you and say, hey, this is the thing to do. And you have a better chance of increasing your outcome, not depending on your physician to do everything for you.
No, I mean, I think that's absolutely wonderful. And, Dr. Joseph, I just, again, congratulate you and the Doktorconnect team for the progress that you've made, for the innovation that you've created, and for being a part of the Velocity and Methodist Healthcare Ministry Accelerator. And, we're excited to see how the demo days and the presentations go for the end of this. But again, just wanted to thank you for coming here today to share with our community all the great things. And again, Texas born, right? People don't realize what's going on in our communities here, right here at home. People think it's all happening in Silicon Valley and, New York and those sort of things. It's not true. Innovations that's changing lives across the world is happening here in our backyard. And again, just congratulations to all of y'all's success.
Thank you so much for the opportunity given to us by Methodists to have a crack at it. We are grateful. And when we write our history of success, our story of advancement, Methodists will have a big part in that history for giving us the opportunity to come in and come back to our home state and do something significant. So we are very grateful.
Well, great. And thank you so much, for being here, Dr. Joe and Joseph. And for our viewers that are watching us, thank you for tuning in on this episode here. Again, it's exciting to talk about what's going on in our community, including the Methodist and Velocity Accelerator, which is where we're bringing innovations from across the country, innovations that are impacting the world here into our community, to then help accelerate them and have them invest, deploy their pilots, their innovations in our community to have absolutely amazing change for our community here. And it's just an exciting thing to be a part of. So if you've enjoyed this podcast, or if you want more information, please leave us a comment, hit like on whichever platform you're watching us on, and we'll see you in our next episode, where we go into our next member of the cohort to talk about all the exciting things going on in our community. See you then.